morning, everyone.
Good morning.
I'm Daivd. Before I start, let me know you my improvement. Number one, my presentation needs to be more simple and compact, thick, because the last presentation was 14 minutes. It was too long. So I will make short. And number two is show you my happiness with this presentation. Okay. Let's start. On 28th April, 6 p.m., we had a special class, right, with real working nurses in field. I'd like to tell you some interesting story from those real nurses. So, the question that I choose is, what the biggest mistake in your nurse life? The first nurse I talked with, her name was Kim Jong-un. He's working at Physical Examination Center in Samsung Medical Center. She has a 6 years career. Actually, she spoke in Gyeongsangdo accent, so I'm really familiar with her. Anyway, when she was new at her job, she was at ICU. Infant ICU. She worked at infant ICU. When usually normal baby, when they come out from their mothers, they're about 3 kilograms and over 37 weeks old. But in case of immature baby, preterm infant, just about 2.5 kilograms and below, and under 37 weeks old. One of them, there was just only 0.5 kilogram and just 25 weeks old baby. It's really preterm infant. So anyway, the most important thing for preterm infant is keeping their body temperature, she said, because body temperature, breathing changes depending on body temperature. But she totally forgot taking care of body temperature of that baby, because situation was new to her. So she got nervous, and she too much focused on her senior nurse. So finally, she recognized that the baby's body temperature was going down. So fortunately, he was alive, but he almost dead. Preterm infant. It's really small. A few years later, the baby's parents went to hospital again, let them know how their baby grew up, and expressed special thanks. So she felt real worthwhile about her job. Second nurse, her name was Park Jung-un. She's working at Hanyang Hospital now. She has a 8 years career there. One day, she took care of an old woman who had thigh bone fracture. In the morning, she went to patient's room to give medicine to patient. The doctors already checked her out, and the patient was sleeping. So she just handed medicine to carer. Carer means 간병인. Medicine to carer and just got out of the room. But actually, she knew later the old patient was not sleeping. She was unconscious, like coma. So there was a big accident, but fortunately she was alive. But she was 70 years old, so she died later. But it's a big accident. Like this story, in hospital there are some unexpected situation, and there can be some mistakes. You guys can do mistakes, but nursing job is really relevant to patient's real life. So the nurse needs strong sense of duty, I think. So I think their job is too important and great, pretty much. So, and you guys look great too now, I think. So I'm looking forward to watching you in hospital in near future. So thank you for listening.